Hello, everybody. Welcome to today's LOBA career guidance session on medicine, dentistry, and healthcare. I'm Dr. Sunil Mathai. I'm your moderator for the day. I belong to the 1978 batch of ICSC. I finished my schooling and joined the Government Arts College, did my pre-degree there, did my MBBS from Government Medical College, Trivandrum, then did my MD in Calicut. I did my DM in Calicut itself in gastroenterology, did some post-fellow programs abroad and in India, and finally joined their mother hospital, Kutatugulam, worked there till 2000, and then moved to Ernakulam Medical Trust Hospital. I was there till this February, 2020 February, and just left before the corona. And then I'm right now in Health City, Cayman Islands, working with as a senior consultant gastroenterologist here, heading a therapeutic endoscopy unit. So it's nice to be with you, and I feel so privileged for being invited for the program. I thank all the guys behind this, Dr. Binoy, Dr. Suresh, and all the Loyolites who are there in setting up this program. Let us kickstart the program by telling you some housekeeping rules. We need to know some housekeeping rules just to make sure that the program goes in a fine manner. So please send questions to the panelists via the question and answer box, which is displayed in the lower part of your, could we have the, the questions must be short and to the point. Only questions related to career guidance will be discussed today, and relevant answered questions will be replied to via email or after the session. So this has to be kept in mind before we start the program. I would like to invite our first panelist of the day, Dr. Suresh K. Aravind, who is a role model. In fact, he was our school leader, just our senior, 1 year senior. I would like Suresh to introduce himself and briefly talk about the LOBA career guidance and mentoring program, because he was one of the backbone figures of this program. Suresh, please start.
All right, thanks, Sunil. Can you hear me? Yeah, okay. So yes, thanks, Sunil. That's a pretty nice introduction. Yes, my only claim to fame while I was at Loyola was my classmates elected me school leader in 1977. You know, obviously that started me on a career in management and leadership, which transfers to, 30 plus years. So I owe it big time to the boys of 1977 for trusting me with leadership. A special shout out to my campaign manager of 1977, Rajiv Vergis. It's his birthday today. So happy birthday, Rajiv, if you're listening. Well, let me take a moment to introduce you also to our LOBA Explore program, which is our new career guidance and mentoring program. As you can imagine, there are lots of Loyolites who passed out over the decades from Loyola who are in very senior positions with a lot of experience and success in their careers in various walks of life. And the objective of this career guidance and mentoring program is to see if we can engage them to guide our current Loyolites as well as young Loyolites which passed out in the recent years, as well as children of Loyola members, LOBA members, to prepare them for the future job market. And hopefully we will help Loyola to develop the next generation of well-informed and well-formed leaders. The career guidance program started 2 weeks ago, and some of you might have logged on to that. Today is our second one. Next slide. And we are also obviously going to start the mentoring program. The mentoring program will start in January next year. And for the principal at school is very excited about it. He will be putting together a selection process for that. The mentors will be, as we discussed before, experienced people from various walks of life who are LOBA members. But the mentees are going to be students in year 11 and 12, as well as young LOBA members and children of LOBA members. School students should obviously contact for the principal. Others can contact LOBA through that email there. The kind of topics mentors and mentees discuss include things like college admission, higher studies, specialization, internships, the job market, which is evolving, how to prepare for interviews and so on, career guidance in terms of career progression. Obviously, a lot of the work has to be done by the students and parents, and mentors are there to just advise you. And from our experience, good mentors can really make a big difference in the lives and careers of many people. Yeah. Next slide. So yes, we have covered, we have a whole series of talks coming up, and these are some of the topics we hope to cover over the next several months, different types of careers in different spaces around the world, in different areas. But we're also kind of asking for volunteers from LOBA members who are in any of these fields to kind of, let us know if they're interested in participating, so that they can share their experience and wisdom with the younger generation. Next slide, please. So these are the sessions we have listed right now. We have sessions in journalism coming up. We have defense and engineering, and on January 23rd, we have the kind of cool data science, machine learning, artificial intelligence topics being discussed. And we will have more topics beyond January as soon as we get dates from the school. Back to you, Sunil.
Yeah, thank you very much, Suresh, for the nice words. He's quite a modest chap, having been the vice president of Johnson & Johnson. He knows how to drive things. Okay, let us go into our boys of the day. I should call them boys. We don't want to call ourselves oldies. So I would like Ajju to introduce himself. Everybody, Ajju, Sudhi, Param, and Roy. Please introduce yourself, starting with Ajju. This is possibly around, keep it around 1 to 2 minutes for your introduction. We would like to know about you. Ajju, could you start?
Good evening. Thank you, Sunil. My name is Ajju. I completed Loyola School in 1974. I then went on to do my BDS from Government Dental College, Trivandrum, and passed out in 1979. And after my internship, worked in the private practice for a couple of years before joining back for my specialist training, which is maxillofacial surgery. I completed in 1986. Then went into academics, having worked in different government, medical, and dental colleges for about 8 years. I left my government job and went to UK for further training. I was in the UK for about 6 years and finished off as a visiting specialist registrar in Nottingham. On the way, I managed to get my fellowships from the Royal College of Surgeons of England and Ireland. I came back to India in 1999 and then went back into academics and finished off my academic career as the principal of the Pushpagiri College of Dental Sciences about 6 years back. Currently, I am a consultant maxillofacial surgeon in 2 hospitals in Trivandrum, Anandapuri Hospital and KIMS Hospital. My chosen specialty of maxillofacial surgery basically deals with surgical work of the mouth and the face. In addition to taking out impacted wisdom teeth, etc., we deal with fractures of facial bones, tumors, and cysts of the facial bones. We work along with the plastic surgeons in reconstruction. My unit also is attached to the Sri Chitra Tirunal Institute of Medical Sciences, where we work with the neurosurgeons for correction of craniofacial anomalies, that is, anomalies of the head and the face. So that's my career in short. Thank you.
Thank you, Ken. Thank you, Ajju. That was a very accomplished career. Sudhi, can you start introducing yourself?
Hi, Sunil. Thank you. So I am Sudhindran. I'm a surgeon. I had the fortune, or shall I say misfortune, to be part of Sunil's career all along the way. So we are together in Loyola School, 1978 batch. We passed, and then I've been with him through Arts College, Medical College, and I've actually become his counterpart in surgery. That is, I've become a surgical gastroenterologist. But after my MS degree from Trivandrum Medical College, I went to UK, which is where I got my training in vascular surgery, and subsequently I become specialized in transplantation of organs in the abdomen. So I've come back and joined Amrita Institute of Medical Sciences in 2002, where I'm still practicing. So now I'm primarily doing transplantation of liver, kidney, pancreas, and small bowel. So that's about me, sir. Thank you.
Thank you, Sudhi, for that lovely introduction. Let me tell you that he was one of those mischievous guys in our school, and I'll tell you that when we reached the anecdotal part of this discussion. Param, we used to call him Paramu. He was our junior, but he was a wonderful chap, a lot of sense of humor. Dr. Parameswaran, please introduce yourself.
Thank you, Sunil. I am currently a professor of medicine and a respiratory physician at McMaster University in Hamilton, Ontario, Canada. I spent my professional time between clinical medicine, looking after patients with general respiratory diseases, but with particular focus on complex airway diseases and severe asthma. But a large part of time is spent on directing a research program, a translational research program, which is very patient-centered, which is something which I'll talk about later. But I, as Sunil mentioned, got my ICSE certification 2 years after he did in 1980, had the traditional education, the societal expectation of Kerala, which is something which we'll talk about later, right, whether it's right or wrong. I went to pre-degree at Arts College and Medical College in Trivandrum. Accidental apothecary. I never really wanted to do medicine, but again, succumbed to societal pressures, parental pressures. That's what is expected of children there. I was a good boy, did what I was told to do. And then did my postgraduate training in Trivandrum, and then went to the United Kingdom, spent 4 years there before coming to McMaster University in 1996 to do a master's and PhD, and I've stayed here since then. And that's about it, Sunil. I hope I haven't discouraged anybody.
No, you have not discouraged anybody, but I think you landed up in the right slot because you have reached the pinnacle of your career. Getting a PhD, getting whatever you want, and becoming a chair of one of the prestigious asthma chairs in the world. It is great, but I mean, you've had a great run of your career. I really appreciate your being with us. Roy, he is a baby of our lot. Roy is in UK is a baby of our Lord in the sense that he's a most junior. He looks like a baby also. Please introduce yourself.
Thank you, Sunil. Can everyone hear me?
Yeah, sure. Please fire.
Okay, thank you. Yes, thank you, Sunil. I was just thinking, gosh, this feels like we are back at Loyola and it's school assembly time in a very nice sort of way, surrounded by fellow Loyolites and perhaps a few teachers as well in the audience. So yes, as Sunil mentioned, my name is Roy Vergis. I'm a Loyolite, very proud of it. Belong to the 1986 batch, and yes, very much the baby of this panel. At Loyola, among other things, I was a founder member of the Quiz and Debating Society, and narrowly missed being on the honor roll at Loyola for the ICC examination. After school, I briefly attended the Armed Forces Medical College, and then shifted to Medical College Trivandrum, where I graduated from. So I'm an oncologist by background, and I have been for more than 20 years now. I initially trained in oncology at Regional Cancer Center in Trivandrum, where I subsequently worked as a consultant as well. Almost 20 years ago, I moved to England, retrained initially at the Royal Marsden Hospital in London, where I ended up spending about 3 years in the lab in cancer research at the ICR in Sutton. And I've been a consultant oncologist at academic teaching hospitals in England, including in Kent and Canterbury, and most recently at Mount Vernon Cancer Center, where I gave up my full-time practice nearly 3 years ago when I took on this role at IBM. So professionally, I'm wearing 3 hats at the moment. I'm an Associate Chief Health Officer at IBM currently, and a clinical leader in oncology at Watson Health. I am also a part-time practicing honorary consultant at the Mount Vernon Cancer Center in London, where I continue to see and treat patients mainly with prostate, skin cancer, and lymphomas. And apart from that, finally, I'm an advisor to the World Health Organization, and I'm on the roster of experts in digital health. So 3 roles in medicine and healthcare. So that's about it for me. Thank you, Sunil.
Thank you, Roy. That was great. I mean, this is a great interface. I mean, the audience would love this interface of possibly an MBBS chap going in for artificial intelligence, going in for technology. It is great. I mean, the questions which we have framed for you today possibly covers all of these fields. Now that you have met the panelists, I should congratulate Ram Mohan, Binoy, Krishnuni, and of course all these people who have picked up all these boys from all around the world. It's a great panel. Welcome. Now let us have, once you know your panel, I would like to know who the attendees are, definitely, because we should be an array of Loyolites, parents, a mixture, even guests. So there is a poll going on, and the first question of the poll, which lasts for we have 20 seconds to answer it. Please answer this. So we'll know who the audience are. It says whether you're a Loyolite, parent attending with your child who is a Loyolite, ex-Loyolite, family of ex-Loyolite, Loyola school staff, guest, or others. Oh, great. So we have 49% is Loyolite, and then 23% is parent attending, 20% is ex-Loyolite, 6% Loyola school staff, and we have got a 1% guest. Welcome, everybody. Welcome, everybody. We have a second poll question here. Could we have that? The second poll question is, how interested are you or your child in the careers being discussed today? Of course, I'm sure that this answer is obvious. It should be very interested, very interested. Yeah, 50%, almost 50% is very interested, 32% interested. I'm wondering 14% is not sure and 6% is not interested. Okay, it's nice to know that there are people who are not interested entering a very good discussion. Thank you very much. It looks great. Now let's have a good discussion from all the panelists. We have aligned a lot of questions for you. These questions will be addressed to all the panelists. This will go in a manner which starts about the career itself. We in fact have 5 panelists here who will be discussing about the career highlights, their low points, the challenges faced, the mentors. Each one of you can discuss for about 1 to 2 minutes. I'm sure that we know the time frame. So let's start with Aju. Aju, I would like to know about your career. Your career is something which is unique. You are between a surgeon and pure dentistry. You are a facial-maxillary surgeon. So what were your career highlights, the low points you faced, the challenges, mentors, etc.? Could you start, Aju?
Yeah, thank you, Sunil. I would start off by saying that now, as it was in my time, very few people came into dentistry by choice. It was always the second choice, and it continues to be so. Only thing is that when I was a student, I would say that 100% of the people in my class came in because they didn't get for medicine, but now the proportion would be something like 70%. I think I was extremely lucky in getting an admission in a government college because of all the positives, mainly in the management of patients. I have to admit that in government not the best you can expect, but I think the students were good. We had enough clinical material, and that was a starting point for me. Obviously, my time in Loyola had given me a great footing on knowing what is right and wrong, making me assure that what ethics I should have in my life and my career, and that has helped me a lot. The real choice in dentistry, because getting into dentistry is always second choice, is what you need to do for your postgraduate training. And you have a wide choice, and I took the choice of becoming a maxillofacial surgeon, which is something way between dentistry and medicine. And I was lucky enough that I could go abroad and get trained. As we go on, we'll see that many of those openings that were available then are not available now, but at the same time, other things are slowly opening up. I think I was extremely lucky in having a couple of mentors who have meant a lot to me. And when I always look back, I see that many of the things I do now is because of the mentoring I've got. One is a maxillofacial surgeon in India, and the second was somebody in the UK. Both of them have made a great impression on my life. I think we will talk about this in the next part of the discussion, but this is what I have to say now. Thanks, Sunil.
Sunil, you're muted.
Could you start on the same lines, please?
Is it me?
Yeah, Sudhi, yeah.
Okay. So, I mean, talking about turning high points and low points, I think most high points will have a few turning points where you actually reach the high point. And I have no doubt whatsoever that my first turning point was actually joining Loyola School. There's no doubt about that, because I was initially in model school, and then it's one of my teachers who made me write an exam, merit scholarship exam, which I got through, and I came to Loyola School. And that certainly was a turning point, because the friends that you have there, people like Sunil, of course, and many other people who we still keep in touch all the time. Other turning points, I mean, obviously getting an MBBS, MS, etc., all those are interesting things. But I think going abroad, interestingly, was not only a high point, but it was probably a low point for me as well. That at that time, when you have your family, when you're certainly, at some stage in your career, and then you leave everything and go to UK in a completely new country where people don't know you, you're struggling with your language. And I think first 3-4 months, I really, really struggled, and I had a lot of tension and sadness, and wanting to come back. But somehow I stuck on there, and eventually that was another turning point as well. And if you really talk about the high point, I guess it'll have to be the first liver transplant that we performed at Amrita in Kerala. Obviously, that made me from a zero to a hero, and I think subsequently it's been a smooth ride after that. Mentors, there are so many. Yeah,
true, Sudhi. Congrats on that. I should definitely say congrats on that, because that was one of the highlights of your career. Please go on.
Yeah, I mean, the mentors, etc., etc. There are so many there. I think, so every one of them have been a small point, starting from Loyola School. But one thing which I've learned from Loyola School is timekeeping. That is one thing which has always been something which almost all teachers in Loyola has impressed on us. Although I'm still not good at it, that is something which I try to do all the time. Thank you very much.
Fortunately, we kept the time today. I still
yes.
have to acknowledge Suresh telling me, please, Sunil, keep your alarm in the morning. Wake up at 6 a.m. Don't be late. Yesterday evening, he was mentoring me. Boy. Okay. So on to Param. Please start your discussion about your career.
Just as Sudhi mentioned, Loyola School was a launching pad. There are a number of things all of us would have learned from Loyola. I mean, whether we like it or not, the command of the English language probably the legacy of 200 years of colonial rule. Unfortunately, the command of the English language is equated with intellect, which is completely a fallacy. It should not be, but that was something which Loyola gave us an edge. We had a chip on our shoulders that we are better than the rest of the students in Kerala, and it did help us get through interviews. And I think it helped us right through a bit of self-directed learning philosophy of Loyola, and the ability, the eloquence to talk your way through any sort of muddle helped me get through many interviews. I think we owe Loyola quite a lot for those leadership qualities. But the high point, really, the reason I left Kerala, India, is not because of job opportunities. I want to emphasize this later as well. There are ample job opportunities in India. In fact, you can have an excellent career there. The only reason I left was to pursue academic in a career where I could apply, do science and laboratory medicine, which is something which we'll touch on, and I will touch on later, that our society does not give enough importance to science. We focus too much on clinical care, which is probably necessary because of the burden of illness that we deal with. However, I left inspired by some mentors, and I'll have to specify names: the late Dr. C.R. Soman, the late Dr. Harindra Nair, Professor of Dermatology, the late Dr. T.D. Gopalakrishna Pilla, the late Dr. Apayambika, and Dr. P.P. Joseph. These were some people who had tremendous influence in my career, encouraging me to leave India to pursue academic medicine. And the high point really was able to get into a research position in the UK, and then coming to Canada and being able to pursue a master's and PhD. And we'll touch on some of these issues of the importance of integrating science, pursuit of science in clinical training as we go along. Thank you, Sunil.
Thank you, Param. Suresh, would you like to chip in on the same lines? Please do.
Yeah, so I finished my medicine from Trivandrum, and in my infinite wisdom, along with my classmate from Loyola, Sunil K, we started a clinic at Chavadimukh near Engineering College in Trivandrum. And this was our first foray into an adventure which took a very different turn. Within 6 months, we went bankrupt. We lost all our money. We closed down the clinic. We couldn't pay our rent. And it was a kind of first lesson in life. There are failures, right? Sunil decided to join the border security force as a physician. I decided that I need to learn something called management before I start my next venture. So I went and did my MBA, and after my MBA, I joined the industry, initially with Cipla in India, and later on with Johnson & Johnson in Australia, and from Australia, I moved to Switzerland. I was regional, covering the region, Middle East, West Asian Africa, out of our office in Dubai for a few years, and later on came to the US. Most of my career has been in pharmaceuticals, but the later 10 years, I moved to medical devices, and I was on the management board of our orthopedic and neurosurgical divisions, which is about $10 billion sales worldwide. So yes, it's been, it started with a failure and I always think back and say, if our clinic in Chavadimukh really kicked off, Sunil and I would probably still be working in Chavadimukh. So failures are good in life because that sets you on a different course. And we've been fortunate to have experienced failure early on in life. Highlights are obviously I've been fairly successful in my career. I'm very proud of that. But what touches me most is what I'm most proud of is the people I've been able to touch along the way. People I've been able to mentor, able to develop, able to promote, around the world, and they still keep in touch. Low points, probably the toughest part was after I finished my MBA and was looking for a job in Bombay. And I'd gone door to door asking for a job at all these big companies. And, I got a lot of rejection letters, and, it was pretty tough, especially when you're trying out a new career and, and rejection letters are the only thing you get. It was one of the low points in my life. But fortunately, a company called Cipla decided to give me an opportunity. They did not know what to do with me. They did not know what to hire me, but they said, well, we'll give you a project. They asked me to develop the marketing materials for ciprofloxacin, and they gave me 2 weeks to do that. And I came back and I presented to the board. And I remember still waiting outside the boardroom, hoping for a positive answer at last. And they came out and said, okay, we'll go ahead and hire you. So yes, I've been to very low points, but that set off my career, and it's been, a fairly successful career after that. Thanks, Sunil.
Oh, so, Suresh, it's excellent. From Chavadimukka, you know where he landed up? He landed up as the vice president of Johnson and Johnson, the world vice president. It is not the vice president in India. And that is an interface for MBBS people, because when in the family, Suresh possibly would have been looked up on MBBS. So what has finally come out of it? I mean, that would have been the scene at that time. I was sure, because this taking an MBA, joining a in a medical pharmaceutical company, but reaching the pinnacles of a company where Johnson and Johnson touches 140 countries. Every life, every family is being touched. It's great. A great career you have had, Suresh. It will be an example for all these people. We have another person here who has got a great interface again, Dr. Roy. Could you tell me about your highlights, your low points, mentors, and challenges?
Sure. Thanks, Sunil. So I suppose I'll start at highlights. So I think touching people's lives, sort of my patients, being in oncology especially, has been probably the biggest and the most satisfying aspect of what I have done so far. And there are quite a few others as well. Working at the Royal Marsden, which is the oldest cancer hospital in the world for so many years, having people like Peter Blake, John Shepherd, Alan Horridge, world-renowned experts in the field of oncology, whose textbooks I read when I was an oncology trainee in Trivandrum. Henry Marsh, the neurosurgeon at St. George's Hospital. And I eventually got to know them very well as my mentors, my colleagues, and some of them now remain very good friends to this day. My cancer research, the work that I did at the Institute of Cancer Research, being awarded the ASCO Merit Award twice, was great. I got to meet Greg Zemenza, who won the Nobel Prize for Medicine and Physiology last year in 2019. He was one of the pioneers in the field of hypoxia and cancer, which was the foundation of my research thesis. So my lab research, we created a novel method to construct tissue microarrays. That was very satisfying. And then more recently at IBM, being at the cutting edge of technology, Sunil mentioned artificial intelligence and medicine, working with some incredibly smart people, some of them very young. And in the course of that, I managed to travel quite a lot. I've been to 38 countries around the world. There's a few on my bucket list. In fact, I just came back from Ethiopia before the pandemic hit. I'm looking forward to traveling more. And at the WHO, helping to draft the digital health strategy, particularly in the context of the pandemic, and being invited to the World Health Assembly at Geneva, which was done remotely this year. Low points, I guess anytime I lose a patient is a low point. It's especially hard in the field of oncology when one grows to know your patients as individuals and their families as well. So they mentioned the cold and the dark in England, so it was quite a cultural change, a challenge when I moved. It was winter time, so that was quite an interesting challenge. But challenges are good, right? It keeps one professionally and intellectually challenged. And I tried to do this by involving myself in academic research, leading clinical trials, speaking at conferences, teaching trainees, etc. Other low points, I suppose, you don't get an exam the first time. You do very well academically at school, and you realize that medicine is tough. But all of these are stepping stones, and I've always felt that challenges are very important, and it's important to get out of your comfort zone as well and keep you relevant. Mentors, there's so many, and like Sudhi mentioned, I'll have to start at school. All my teachers, a few especially come to mind. Father Varkey, who was very inspiring as a principal, Mrs. Chako in my year 6 and 7, Mr. Dio Sebastian, Father Pulikal, who were both our class teachers in the A and B division. Boss was very inspiring, and we continue to keep in touch over many years. Father Pulikal, who taught me the importance of always giving it my all, dignity of labor. I still remember him telling us, you can do whatever you want. If you want to be a barber in Srigariyam, be the best barber possible. I'll set you up in the shop, etc. So that was very inspiring. Father Kuruvilla Cherian, who encouraged my public speaking and obviously command of English and comfort, which was very useful, giving me the skills and the confidence to succeed in the big wide world. And in medicine, Dr. Krishna at RCC, he was an amazing mentor. We still keep in touch, and he really helped me a lot. Cherian Vergis of the WHO, who Suresh Aravind knows very well. And there's so many people throughout the course of my school and academic career who've been very influential. And my friends at school, I have to say, I rely on them for advice. Some of them, Deepu John, Raji Subramaniam, I'm embarrassing them, Suresh Vergis, who I've relied on for advice. And we have a very good, robust group. And it's really nice to feed off everyone's energy. Thank you.
Thank you very much, Roy. I think we are getting some good questions also from the audience here. It's possibly related to Roy, Ju. Our next question here is obviously related to that. So let us discuss this. The question is, I'm Dr. Aravind Krishnan. I'm currently doing my post-graduation at orthodontics. It would be great help if information regarding scholarship programs related to dentistry and medicine available abroad could be discussed. Related to that, we have other questions also in training and undergraduation in India and universities abroad where we can undergo additional training. So this question is about discussion of medical admission process, post-graduation, specialization, super and subspecialization as it's called in various countries, in India, and additional training required when studying abroad. So we have an interface here in people like Sudhi, who was trained in India and abroad, Param, who was trained in India and abroad, Roy, who was definitely there, and Aju. I would like Aju to start off with that question in orthodontics, which was asked about dentistry, undergraduate and postgraduate in India and abroad. The person is doing orthodontics, it seems. Could you start, Aju?
Yeah, thanks. Postgraduate training for somebody who's just completing that in India, the options are quite limited, but happily the UK is opening up once more. As you all know, when we trained, we had an option of going to UK to train, and then with the European Union coming in, dentistry and other specialties got totally shut off. But now I'm told that with the Brexit, things are opening up now. With regard to the exact mode of scholarships and the way to go about training, I don't think this is a particularly good venue to talk about it. But with regard to the US, Canada, and the other English-speaking countries like New Zealand and Australia, as in other specialties in health fields, the link to the requirement to the positions. So I think this has to be a 1:1 discussion with the doctor, the orthodontist, and I will be happy to answer him if he gives me a call later on. Thanks.
Cool. Thank you very much, Aju. That will be a personal answer to him. Sudhi, could you discuss on this broad question which we have framed for you? And this might answer many of the questions which are burning in the mind of the audience also. Could you start, Sudhi?
Sure. So I think one of the questions now that is often, in the minds of students as well as parents is, if you become a doctor, are you going to get a job? Because there are so many doctors out there. Everybody is finding it difficult to get a job. Should we become a doctor? So if you actually look at the numbers, the number of seats in India is like 66,000. That is the actual number, maybe around 67,000. And last year, 14 lakhs applied for that. I mean, they wrote the entrance exam for that, which essentially means that only 4 out of 100 will get through. It's needless to say, it's a tremendous competition. But still, it's a question of hard work. I mean, that comes with anything that you want to do, whether it is music or acting or whatever, there needs to be hard work. So if you have that hard work and the focus in it, you will be able to get through medicine. I don't think that's a problem. Second issue is that once you get through medicine, I mean, are you going to get a job to work? Again, if you look at the actual numbers, the WHO recommends that minimum number that is required is 1 doctor per 1,000 population. We are in India way behind. We're only 0.7 per 1,000. I mean, in Kerala, it's a bit better. It's more than 2, but majority of places, it is less than 1. So we are still far less numbered than we are actually need to be. So there is a need for doctors. There is no question about it. The problem is that everybody wants to work in the cities where, the corporates and the, and the big hospitals, they play, because that is where the money comes in. And that is the issue. Therefore, you need to go for specialization, super specialization. It goes on like that. And therefore, it depends on what you want to do. But at the end of the day, there are enough numbers for everything. So if you do want to MBBS, if you want to work, there are places where you can do work, do good quality, excellent work, catering to India, what India actually needs. On the other hand, if you want to be a little bit more specialist, you can do that. And going abroad is certainly worthwhile. It is not that, as Param mentioned, it is not that training is lacking in India. Good clinical training is available in India now, but it is always a good point to go abroad because you can see another system. You always learn something from there, and you can always come back, from what you have learned abroad. So these are just the base things there. So I think that it depends on what you want to do, how your subsequent progress in your medicine. But certainly there is enough jobs for people if you become doctor.
So the question actually was targeted towards the admission process, the additional training required when working abroad. Your answer is possibly pertaining to the third one. I'll come back to you later. Can you,
Okay.
can Roy, can you do some more, can you throw some more light on the present UK scenario of higher studies in UK after undergraduation, or possibly do an undergraduation in UK itself? Could you cover both?
Sure, Sunil, thank you. So let me start with medical school, because our daughter actually is in her 4th year at Imperial in London. So I think the good news is that foreign students, international students, can apply for medical schools in England and in the UK. Obviously, there is a very systematic process, which obviously includes your academic marks. You have to prepare a personal statement, which obviously will need to cover the factors. Why do you want to do medicine? Extracurricular activities, and things like volunteering, etc. And depending on the medical school, you do either what is called the UK CAT exam or the BMAT examination. And now I have to say, my wife and I didn't know a lot about this before our daughter started applying. So that was new to us. But, it's a formal interview process that takes place. It's usually a panel or an OSCE system, and it varies from medical school to medical school. And then coming to postgraduate.
Can I intervene here? Can I intervene for a second here? What about the expenses compared to India?
Sure. I was quite surprised when I saw something on our school WhatsApp group recently about the cost of medical education in India. Perhaps that's more to do with the private medical system, private medical schools. But yes, Sunil, they are quite expensive, right? So without going to numbers, they charge a lot more for international students per year compared to someone who's resident and has been through the schooling system here. So yes, definitely there's that cost element. But I was, like I said, I was quite surprised to see that in some ways it is comparable to what some of the medical schools and colleges in India are charging. And then coming to postgraduate training. Now, it's been a long time since I've done what we call the PLAB examination. So I'm probably not the best person to give advice on the system. And there are probably people who have done it more recently who can give better advice. But essentially, what you need to remember is what the PLAB exam is trying to understand is, are you as a foreign medical graduate able to show core medical competencies comparable to a graduate from the UK medical system, if you will, medical schools. And obviously there's cultural and communication skills, etc. So it's always a good idea to consider coming to England for observership training in a teaching hospital before you take the exam. And then again, depending on the specialty, there are various routes, the academic route. Now there seems to be a lot more of a market if that's the right word, for international medical graduates to come in various specialties, in brief. But then again, I'm happy to talk about that offline.
Thank you, Roy. It is nice to know that the undergraduation can be done for foreign students in UK. The message is that, and but it's expensive, and of course, the post graduation is always on the take if you are interested. Dr. Parameswaran, see, it's mostly the destination for an undergraduate is always UK, US. Of course, now you are possibly one of the toppers in Canada. Could you take us to US and Canada and tell us more about the medical education systems there? Param?
So, Nil, before I get to that, I just want to make a brief mention about the education. We need to focus on getting into med school and then higher training in India or abroad, and then focus specifically on Canada. But getting into med school in India, I mean, it's the issue of outliers. As Malcolm Gladwell said, if you are good at, and as Roy mentioned earlier, in order to get into a good medical school, which used to be in those days when we graduated Trivandrum Medical College, but now the government medical colleges, Calicut, LP are all very good, but there's a proliferation of medical schools. So these Loyola students, we have an edge, and we should try to get into the best medical school in Kerala or in India. My first recommendation is not to try to do your undergrad outside India. Try to do your undergrad in India. It's very expensive to go abroad. I hate to burst this bubble of undergrad education in the UK. You can get into a medical school in the United Kingdom in many places if you can afford it. You can buy your seat just as you do in India. These systems are all a hogwash. You can bypass all this if you're rich enough. And I hate to say this in front of this large group, but there are ways, and I know mediocres who have got to do med schools abroad just because they can afford it. So my first advice to students, listeners, is to try and excel yourself and get into a very good medical school for your undergrad in India. Now, coming to Canada or the UK, Canada in particular is almost entirely closed for undergrad medical education. So you cannot get into a medical school in Canada unless you're a landed immigrant or a Canadian citizen. It's virtually impossible with very few exceptions. But getting into a postgraduate training is a bit easier, certainly much more difficult than in the UK or in the United States. There are 4 routes. I'll very briefly mention this. Again, it helps if you're a landed immigrant or a Canadian citizen. So the whole process is to get an immigration status. It's intertwined with your visa status to get into higher professional training. It's much easier. You can come for short-term fellowships. I take students who are 1 or 2 years fellowships for master's, PhD, and clinical training, but that's entirely funded by my own grants. But in general, the way to immigrate to Canada to do postgraduate training would be for a fellowship training specifically for 2 years. At the end of 2 years, you would have to leave Canada to return to your home country. You cannot reside in Canada unless you've got a landed immigrant status. If you're a landed immigrant, you could either get into the full scenic training. Even if you're a super specialist in your own country, you might have to redo your entire training in Canada if you want to get a full practicing license in Canada. Unless there are only 2 exceptions currently. If a university in Canada feels that you're appropriate to bring in an academic side to the university and you can contribute something which a Canadian trainee cannot, you might be given a limited license to practice in that university and that province in Canada. The second route for a permanent license in Canada would be if you're bringing in a highly specialized subskill. For example, if you are able to do a left LOBA temporal lobe lobectomy for seizures in pediatric children in Newfoundland, in the far east of Canada, you might get a license to practice there. So it's very, very difficult to get license in Canada. But my advice would be to do your undergrad in India and then go for short-term postgraduate fellowship and either these return to India, or if you want to stay in Canada, apply for landed immigrant status.
That's a great advice. So obviously one of the messages to the audience here should be, even if you do an undergraduation, if you want to get into the system, you may have to rewind the whole thing again in Canada or US and go through that system again before embarking on a job either in US or Canada. Is that the message, Param?
Yes, yes. So you may have to do a lot of retraining, and it's entirely the same situation in the United States, although it's much easier because there are much more medical schools in the US, but the system is exactly the same. You'd have to take your USMLE exams and do a retraining in your broad specialty and in your subspecialty, unless it's for a short-term fellowship, after which you return to your home country.
Which means that only people who plan to get married in US or Canada, they are planning to settle down there. Those people can possibly go through that retraining business. Otherwise, you are looking at a long career. You're looking at 5 to 6 years of MBBS in India. And then, so what he says is the best sense possible. Go for short-term fellowships. Get your education there, and then of course you can come back to India and practice, unless you want to settle down there. Great message, Param. It's nice. Now, once you go through this, there are certain questions which was asked here. Let me ask you one question. Do you have scholarship opportunities abroad after the 12th standard? It seems to be a nice question, because after +2, do we have any scholarship for medicine abroad, either in UK or US or Canada?
So I can chip in and I can say there are absolutely no opportunities to get scholarships to do an undergrad medical school in Canada. It's virtually impossible. There might always be an exception, an isolated instance where the scholarship might be a rich parent themselves.
Okay. What about UK? Is it the same scenario? Roy?
Yeah, I think
it is. Yes, I think Sudhi was just going to say that, and Param knows this very well as well. So no, short answer is no.
Okay, good. Sudhi, one of the things you can possibly quote is your son is doing he is doing a post-graduation in Mayo, Rochester. Yeah. Could you just tell me the way he went through?
So essentially he did his MBBS, and he also passed his MS in general surgery here. So which is like 5 + 3, 8 years. And then he had to obviously have to do the USMLE exam, which is like the final year exam there. And so once you do that, you need reasonable scores, and then you apply for your surgical residency. It's like a matching program. In essence, it is almost like the NEET matching that we have here in India, almost exactly the same, except that in addition to the score, the final interview carries a lot of mark as well, which essentially means that, if you know the people there, where you want to get in, then they will, there's a chance that you might actually get pushed through. So he got into the program, surgical residency program in Mayo Clinic, where there are 20 seats, of which 10 are what is called the categorical post, and they go all the way to the 5-year training program in surgery. The remaining 10 are non-categorical. So which means after the first year, you again have to go through this matching process. And so there, he didn't get there. He had to go to Phoenix in Arizona for the second year. And this is predominantly because he hasn't got a green card, or he's not a US citizen. So these posts, as Param was saying, are essentially restricted to US citizens or green card holders. Therefore, subsequent progression becomes difficult unless it is a post where they have vacancy. Sadly, surgery is not a post like that. So now he has to go to the 3rd year, 4th year, etc. And that is a lot of struggle. Fortunately, in UK, it's a lot more easier. I mean, if you go from after MBBS, not MBBS, after your MBBS, if you go there, you have your lab, and there, to get into a program is a lot more easier. And it's much more easier than definitely Canada and even US, I think.
Can I chip in, Sunil? Just one brief comment. In Canada, for highly specialized short-term fellowship, it's extremely easy. In fact, it's easier than the US or the UK. For example, I've taken about 7 physicians from India in my laboratory and clinic for training for 2-year fellowships. So all that you require is a professor of a university in Canada signing off and vouching for your ability, and you could get a short-term licensed education license to practice under supervision. But essentially, I am funding them from my grant. So obviously, it has to be someone who meets my expectations and standards. So it's not a question of I'm investing and I need return on investment in terms of productivity and good quality care to my patients. So just a short term it is possible in Canada for any jurisdiction, including surgery, including surgical specialty, you'll get a full education license, but for that period funded by your sponsor. But
I
for
think the
only
same goes.
postgraduate.
Thank you, Paramais. I think the same goes for Australia as well as Europe. Would you think Australia? I think only one person worked in Australia here with us. Dr. Suresh, do you think that we have opportunities in Australia in a similar way, post MBBS fellowships and likewise?
Yes, the Australian system is very similar to the British as well as the Canadian system. Obviously, I've not done it myself, but there are a lot of people coming for higher training in a lot of the good universities in Australia.
So thank you. Well, I think let us go to the next relevant question, because this has been just voiced a bit. The job market and competition in India. See, most of the skepticism is you have a long studying career, around 12, 13 years of education, you get employed late. Because can we just stop at MBBS? Can we just stop at MD? Can we just stop at another super specialization of either DM or MCH or FRCS or whatever the likes is? So can we do that? Or do we get a job after MBBS? What is the job market, the present scenario in India? See, being a part of the Cochin IMA and the president of the Indian Medical Association, one of the things which I found was the job market is there, but then you have to be prepared to move to the rural area or the periphery. For example, in MBBS, after MBBS, you can get a job as a casualty medical officer in the metros. It's very unlikely that you can, or you can possibly be an assistant to an assistant somewhere in a major working units, just to get an exposure to the unit. Otherwise, after MBBS, if you're planning to stop in India, if you want to practice independently, then the chances are towards the periphery. So I just wanted your opinion on all you specialized guys in India. How is the job market and the competition? Sudhi, could you, Roy, Param, Aju, anybody, could you throw some light on that?
I think maybe I can start. It's exactly as you said. If you look at the numbers, we are far short of the numbers that is actually required to meet the actual number of requirement of doctors. But sadly, it is all in the rural setup. It is not even in Kerala. In Kerala, with an MBBS, of course you can practice. You won't starve to death, and you will have a reasonable amount of money to practice with MBBS. Except, as you rightly said, it has to be in the rural areas. Looking at fever, cough, etc. So, which is not what most people sadly don't want to do, which is what is required in India. It is the dysenergy that happens in the medical profession. What is required is often not met. We have this situation where there are so many super specialists around, but still, even for super specialists, a lot of them are still lying vacant. Some of them are still lying vacant because there are jobs that has to be taken in terms of seats or job opportunities. So I honestly think that there is a lot of vacancy.
Yeah, you honestly think there is a vacancy, but as a specialist, which I went through, I found that what I thought was after MD, your chances of getting after MD now as a general physician or a general surgeon, your chances of getting a job possibly affiliated to a unit is there, but an independent job is still lacking. Then you have to do your super specialization. Even the subspecialization, now you find that they are cropping up. A lot of them are cropping up in the periphery. The government is absorbing a lot of them. Doctors are required, definitely. A lot of doctors are required. But then the proliferation of doctors ensures that specialty services are now available in the rural area. And you should be mentally prepared to work there. So that is some message which we have to give to the audience. Not everybody would be able to work in the metro. Not everybody will be having a godfather or a mentor where you might have an easy go through. or even working abroad, you possibly need godfathers to get a good job. If you have a good connection like Param over there, maybe you can land up in a good center in Canada. Am I right, Param? Is it right?
Well, sort of, partially. It's no. If I could comment on just one of these, there are a number of questions about the Q&A in the Q&A box as well, which is relevant, which is about. I mean, the reason you go into medicine as well. I mean, if it is simply to serve humanity and the masses, it's just fine. There is ample opportunity in your own backyard. You don't have to travel and cross the oceans. But that is not the entire reason we go into med school. Let's not speak with a forked tongue. There are always other motives. It's for fame, fortune, successful career, fulfillment. If it's simply fulfillment and service of humanity, you don't have to go anywhere. There's ample opportunity right in your backyard. But if it is for monetary gains, perhaps it is not the best idea to leave, because in an academic situation in the United Kingdom or in Canada, you do not become rich. You're well off. You'll never poor. No physician ever starves, but you'll have a modest life. If it's to make a lot of money, you go into private practice, and private practice does involve a bit of maverick practices, and whether you practice in India or abroad, just because you're abroad doesn't mean it's always ethical practice. There are a lot of unethical medicine outside India as well. So it's a question of your priority. If you want to be very successful academic, you go into the best medical school. There are questions about what's the list of medical schools. It's published in India. There is a rank list, and you can pick the top list. And the institution that Sudhi works in, an Amrita Institute, is now ranked as one of the top 7 in India. So you do have a rank list. You try to get into the top 10 or 20, and then you excel. If you want to serve humanity, stay in India. If you want an academic career, which is what I wanted, I didn't leave to be rich. I left to pursue research. You go abroad. So that's the honest answer to the question, Sunil.
Thank you. Thank you. I think we should go into the next question now. There is a question which one person has asked regarding biomedical research and choosing between biomedical research and medicine. So we have a question here framed exactly for that. Choosing between academic medicine and clinical medicine. Param, I think you would be an ideal person to answer the question. Choosing between academic medicine and clinical medicine.
I will make it very brief. One should not dichotomize. Good academic practicing in a university does not necessarily make you an academic, and likewise practicing in the community does not make you not academic. Academic medicine simply means a lifelong pursuit of knowledge, learning, which is not obtained from medical representatives by books and universities and lectures. So the take home, the simple message I want to leave is that we should encourage every one of the Loyolite to combine the practice of clinical medicine with the pursuit of knowledge and science, whether you pursue it in a university or pursue it in the community. Let's not dichotomize it.
Oh, well spoken. Sudhi, do you have any thoughts on this?
Well, yeah, my thoughts are, I completely agree with what Param said. But then, if you really want to dichotomize, there is a division in the sense that, there is a clinical medicine and there is a basic science medicine. So that there is a big dichotomy in that, because the people who are in basic science medicine, it is very difficult for them to continue doing the basic medical science if you are in clinical medicine, because it becomes too difficult. You can't excel in either. So clinical medicine is very popular because it deals with emergency patients, emergency surgery, CT scans, MRI. That's which gives you this godlike thing. And of course, the money is there. The corporates are involved in that. But the real academic medicine, to dichotomize, the basic science medicine, which is where the real men actually lie, because that is what makes the difference in medicine. That is where the Nobel Prize winners come. But then it's real hard work. It's a difference between a marathon and 100 meters. It's a lifelong thing, pursuing, failures after failures. That's a very difficult job with very little money, very little fame. So that dichotomy is definitely there. And sadly, in India, it is not encouraged at all, this so-called academic medicine. There is no money in that. Nobody encourages it. And if you want to pursue that, like Param did, you have to go abroad for that. That's the sad truth.
So the message would be, if you want to pursue biomedical research, you should go abroad?
Probably. I mean, I think that's the way it is as of now. And if you really want to go, yeah, you will have to, I
Okay.
think.
There is also another question which is on the frame, which is about the different careers which possibly can be branched out from MBBS. I think that question is possibly our next question frame. Anyway, the questions which are coming from the audience are already there in the frame. So I would like Suresh to answer this. See, he is a person who has diversified from MBBS into MPA and taken a career in a different line altogether. So can you tell us more about careers for MBBS chaps after finishing your medicine in the industry, in pharma, biotech, medicine, device, whatever it is? Suresh, can you enlighten us?
Yeah, sure, Sunil. And you're right. Traditionally, doctors, nurses, pharmacists work in hospitals and teaching hospitals. But there is a whole area of healthcare where there are opportunities for physicians. I'm going to use a few slides because this area is kind of not very clear to our audience. So slides can help. Can I have my first slide, please? So generally, we talk about the 5 Ps of healthcare, which includes physicians, patients, providers, and policymakers and payers. Binoy, can I have my first slide? Is it on? Okay, looks like we don't have it, but I'll walk you through. From the standpoint of careers, all these areas, whether it is producers are companies and entities which produce pharmaceutical products, medical devices, research centers which produce research data on new targets for research and medicines. So all these centers, all these producers hire a lot of doctors, and I'll walk into those in detail once I get my slides. From the payer standpoint, again, the payers are insurance companies, governments, employers. All these entities also hire doctors and nurses and pharmacists. From the policy standpoint, we have obviously WHO, the government, we have regulators like the FDA and the drug controller. We have health technology assessors like in UK, we have NICE. All these agencies also hire doctors, hire pharmacists and nurses. And so you don't necessarily have to practice in a hospital after you finish medicine. So there are a lot of career opportunities. And my intent of using that slide was to kind of show that there are a lot of opportunities outside the hospital. Now, specifically about pharmaceutical and medical device companies. All right, thank you. Thanks for the slide. But I think I've covered this. What's key here is to say all these areas which are in orange are areas where doctors and nurses and pharmacists can approach for careers. I didn't touch on under the producers bucket. You'll see health data companies. These are the Googles, the IBMs, and we have Roy from IBM Watson here with us on the panel. Again, a physician of physicians playing a role in the industry. So a lot of the big IT companies are getting into healthcare because this is a hot space, with a lot of data. NGOs like the Bill and Melinda Gates Foundation does a lot of work in health-related issues around the world, and they hire a lot of doctors as well. So the objective of this slide is to just broaden the scope of our audience to understand that you don't necessarily need to work in a hospital after you graduate. A lot of these places you need specialization. For example, if you're going into the WHO, you need probably some training in public health. And if you're going into some of the other fields like medical devices, you might have to have preferably a surgeon, because mostly it's surgeons who use medical devices or medical instruments. So keep that in mind, but opportunities are there. Okay, so that's the intent of this first slide. Next slide, please. So this is just a list of some of the top pharma companies in the world. Again, I mean, if you can get into one of them, you get to experience a career around the world. But again, not easy to get into the multinationals. Next slide. Fortunately, India is actually one of the big, pharma countries in the world. We produce about half of all generic medicines which are sold all around the world. And this is just a small list of companies in India which hire doctors and pharmacists and nurses. And as you can see, a lot of them are pharmaceutical companies, some of them are consulting companies, some of them are contract research organizations, so CROs, some of them are IT companies which have a health division. So yes, doctors can explore careers outside of medicine, and there are ample opportunities in India, provided you get the right kind of training and certifications. So if you're going into clinical research, you need clinical research certifications. If you're going into medical informatics, you need that kind of training and so on. Next slide. So I will dwell deep into what happens inside a pharma company, just so for those who have not got any feel for it. Within any big pharma companies, there's multiple departments, and you'll be surprised that we hire doctors in many of these departments, and I'm going to drill down into a few of them. Next slide, please. So let's start with R&D. Within research and development, there's obviously drug development, and that's mostly the science people. There's PhDs and research people with really the science background. Then there's the animal studies, where we hire veterinarians, we hire pharmacists. Then it comes to clinical research, where the trials are being done in human beings. A lot of doctors are hired to do clinical research, mostly specialists who are in that space. So if there's a gastro product, we hire a gastroenterologist. If there is a neuro product, we hire a neurologist. And then there is a whole area of operations, which is not the people who run the trials, who are operating the clinical trials. And these are usually nurses and pharmacists predominantly, but there are also a few doctors who get into that space. In the patent and law department, we usually hire lawyers, but a lot of lawyers also have medical degrees these days because they want to combine the science with the legal aspects. But if you look at medical device companies per se, generally we hire engineers because medical devices are all engineering devices. But there are a handful of doctors, as I said, and mostly people who have dealt with medical devices, surgeons, for example. Now, if you have a gastro division or a cardiac division, we try to bring in a cardiologist, okay, or interventional cardiologist. So all those which are in orange here, just to show you, are areas where doctors have some role to play. Next slide. So going into scientific affairs, this is once the research is done, we're launching the product. We have obviously to support marketing. Again, in marketing support, medical support for marketing, in regulatory affairs, discussing with FDA, discussing with drug controller, health economics, trying to find out how to price these drugs and make it available to people around the world. Safety monitoring, looking at adverse events, looking at data coming in from after we have launched the product, if there's any serious side effects which we need to monitor. Medical informatics, providing information to doctors and physicians around the world. All these areas hire a lot of people from the healthcare space. Some areas, obviously, a lot more doctors, some more pharmacists and nurses. Next slide. So in terms of other departments, can I have the next slide, please? Okay, so in sales and marketing, again, very few doctors. Mostly it's nurses, pharmacists, sometimes even engineers. And I have seen a few doctors in some countries like Egypt. We get a lot of doctors who come into sales and marketing. Again, if you're interested in sales and marketing, you can always get into it, but it's a bit more of a long ride. To get into marketing, you need some sales experience and an MBA, preferably. And then there is this area called market access. That is to make drugs available to poor countries, where the prices can't be afforded, the patients can't afford the price. There we hire people with medical degree and a public health kind of background, which can help them. In management, obviously, in all these departments, we have department heads, and many of them become doctors who have come through the system. And again, many of them are nursing or pharmacy background. In terms of reaching to the very top, there are a couple of doctors who are CEOs of big companies. Novartis CEO is Vasant Narasimhan. His roots are from Chennai. But the smaller companies, a lot of doctors are CEOs of those companies. So again, the whole objective of this slide deck is to show that there are opportunities beyond hospitals. Next slide, please. So manufacturing and production, supply chain, quality, not a space for doctors, unfortunately. But in complaints, we hire a lot of nurses and pharmacists to kind of look at product complaints. And even though it's mostly engineers, but there are opportunities there as well. So that's just to give you a flavor of what happens inside the industry and where the job opportunities are. And my whole intent today was to just kind of give you exposure that there is careers outside of hospitals. So no, thanks. You're on mute, Sunil. You're on mute. Sunil, you're on mute.
I'm sorry. That was a great insight into a whole lot of medical careers. I mean, through your MBBS, you have gone into a field. You can leave your stethoscope alone. You can possibly walk into an areas where a lot of interest is there, where MBBS can be your basic education. That is extremely interesting, extremely interesting. But then there is one thought which an attendee has already raised. Now, you are focused on as becoming a doctor, you're focused on treatment or healing or something like that. That is the focus your family also has on you, isn't it? And then
Yes.
how easy is it to switch careers? I need two people to answer this. One is Suresh and two is Roy.
Yeah, so that's a really good question. And remember, change is never easy, right? We are always reluctant to change. And when I switched 30 plus years ago, there's a lot of pressure on me. My parents were not happy because normal kids become doctors and cardiologists, and you decide to do MBA, and they were very upset about that. But things have changed. As I showed you in the slides, there are a lot more doctors in the industry now, a lot more nurses, a lot more pharmacists. So things have evolved over a period of time. But my only suggestion is, if you were planning to change your career, try to find a good mentor, because that can make your life a lot easier. I did not have mentors when I started, and I had to do a lot of things by trial and error. But these days, obviously, you have better options. My one advice, if you are interested in getting into the industry, is get involved in research, even when you're studying. If you're a PG, doing a postgrad, do some kind of research. You'll be surprised. When I was in Bombay and working for Cipla, almost every postgraduate student in Nair Hospital or JJ Hospital or KEM, all the big hospital, All India Institute in Delhi, all of them had some research project they participate in. The reason is pharma companies have a lot of budgets for research, and they're always looking for data. So all you need to do is write to them and say, I want to try your drug in particular indication or particular condition, and can you please fund it? And it's, as long as the protocol is reasonably scientifically robust, they're willing to fund you. So all these PGs make a little bit of money on the side. And the beauty of it is you have a research paper, a publication, which you can present at congresses, you can publish it. So you also get your citations as you're studying. So that kind of also builds your relationship with industry. So when you decide to switch, they say, oh yeah, we've worked with Dr. Sunil for a few years. We like the way he does research, and we're happy to bring him in. So my suggestion is, one, find a mentor. To get involved early on, even when you're studying, that kind of sets you on that track. I hope that helps.
Yeah. Roy, what about you?
Yeah, thanks, Phil. I think I agree completely with everything that Suresh has just said, and also what Param and Sudhi and you have alluded to, and Raju as well. So I think my bottom line, I would say, is be open to opportunity. When you choose medicine, first of all, ask yourself why. Why am I choosing medicine? What is it that is drawing me towards it? And in that frame, I would also encourage you to ask yourself, who am I? What is it that I enjoy doing? What are my passions? And you may find that you have one, or you may have others. You might join medicine because you have a certain passion or attraction towards it, and that can change. You might find yourself, as Suresh alluded to, you may find yourself impressed by a mentor, something that he or she is doing. So be open to that opportunity. Be always willing and keen to learn. I think some of the most interesting and successful people I know still are not sure about what they would like to do. And I'm talking about 45 or like me, 50-year-olds. So it's very important, 10, 20, or even 30 years later, when someone asks you, you should be able to say, this is who I am, this is what I do, and this is what I enjoy. And everything else that Suresh has alluded to. But most importantly, be willing to learn and be open to opportunity.
Sunil, can I just say one word?
Yeah, sure. Please.
No, I think there is a general feeling that treating patients and looking after the sick ones is what medicine is all about. But that is actually just the tip of the iceberg. What lies below is actually what you have to apply to these patients. And there, for example, finding a new medicine, finding a new technique of surgery, the basic research, everything that goes on is so much. That is what people like Roy and Param and Suresh are doing. So it is just because, Suresh does look after patients doesn't mean that he's not working for the patients. That's his ultimate aim. So it is just where your passion lies. It is equally, if not more important than actually seeing a patient face to face or operating a patient. Thank you.
Absolutely, Sudhi, absolutely. Because Suresh was telling me the amount of people Cipla saved, Johnson & Johnson saves in the world, because it is not, it is millions, in fact. And what we can do possibly is save one. Yeah.
Yes, very true.
Okay. Okay. So let me go into the next question here, because this has already been voiced by one of the person in the audience. What does it take to be successful in your career? What makes you a good doctor? Now, let me just tell you, if you mean a doctor, now you'll have to define a doctor here. It's difficult because it's not a person who heals or a person who puts a stethoscope on your patient, who does some research. A doctor is, in fact, if you, many of us should know that the word doctor means to teach. It possibly originated from, there's a word called docere, D-O-C-E-R-E. I think it is either Greek or Latin. Whatever it is means to teach, because you are a master of that subject. So you are a PhD. He's Paramis twice a doctor. He's a doctor of philosophy, a doctor of medicine. So a doctor means not a person who treats. It's a doctor means a person who's a master and who is possibly teaching. So what does it take to be successful in your career? Aju, can you just start with dental career? What makes you successful? What are the competencies and skills you should have?
Dentistry is much more hands-on than medicine, at least in the undergraduate level. And I know of only very few people who are innately good with their hands. Most of us get good with their hands because of the exposure and repetitive doing of doing what we want. Now, if you ask me what makes you a successful dentist, I would say number one is, as has been alluded, your sense of achievement in what you could give back to your patients as far as in what you do. The number two thing is, I think recognition in society is very important for me. As a professional, as a good dentist, as a good maxillofacial person, surgeon, and of course, as a good human being. And finally, I would think monetary benefits of being in a profession that, as Param said, not make you rich, but at least not wanting in doing the things that you want to do in life. So as far as dentistry goes, I think just to come back to one question that was asked before, what are the objects, what are the prospects of a BDS graduate? The WHO says the ratio is 1 dentist to 7,500 population. In India, statistically, it's 1 dentist to 10,000, but in Kerala, it's almost down to 1 dentist in 4,000 and counting. That's because the decadal growth rate, population growth rate in Kerala is decreasing, and the number of dentists in Kerala increasing. So basically saying that competitiveness going up, and as has been told again, if you are willing to move out to the periphery, you've got a better chance of survival. Thank you.
Oh, thank you, thanks, Raju, thanks a lot. As possibly most of us are focusing on this aspect of moving into the periphery, where more and more doctors are required. Roy, there is a specific question possibly addressed to you regarding artificial intelligence. Regarding the prospects of artificial intelligence in medicine, and is there a redundancy on it? Could you just answer that question?
Sure, thanks, Sunil. And that's a question I've been asked time and again over the last 3 years. So I'd like to frame it a little differently. It's not necessarily artificial intelligence, but it's augmented intelligence. So anything that helps humans, and specifically in the field of medicine, dentistry, healthcare, anything that can help us clinicians do our jobs better. And there's a lot of exciting work, some of which unfortunately I can't share with you because of non-disclosure agreements. But just to give you a brief sample, if you will, So there's a lot of work that's happening in imaging around neural networks and machine learning. So for example, helping radiologists find and locate tumors which they may have possibly missed, and just making their job a lot easier. But the key part here is helping them, right? So it's not necessarily making them redundant. It will take some of the mundane and boring work out of what they do. So we're doing some interesting work around the cancer treatment pathway and making the tumor board more efficient, saving time. And there's work around detection of tumors, artificial intelligence in the aid of pathology slides. My wife is a pathologist, but I'm not suggesting that they are going to lose their jobs, but anything that sort of helps. Some really amazing work, and we're going to see more and more technology being applied in the field of medicine. But you know what? That's something that we've been doing for the last 2 or 3 centuries. Sudhi is a surgeon, and the MCH degree was based on the original surgeons being barbers, and then of course science came in, and it evolved as a practice. But that's always been the case. It will continue to be the case whether we have technology or not.
Good, Roy. But about the essential skills and competencies as a moderator, what I always felt is you should have good communication skills. Because every day you are meeting a patient, if you have a lot of empathy, if you can speak 1:1 over the table, then possibly you can be a successful doctor. Your competency, of course, competency depends on your intelligence, on your physical capability of endurance, a lot of other factors. It's multifactorial, the competency. But then a person who has failed in medicine might be one of the biggest Einsteins around. So it doesn't mean that competency can be measured in certain terms. It's a kind of brain function which is totally different. But communication skill you should have if you're a practicing doctor. If you're in research, possibly you should be more focused. I think your focus is more important. And that aptitude of research, because research is an extremely patient job. Now, let us go into our school again. So how has school helped us? Because I understand that all of us sitting here have been fairly successful. I'm sure that I don't know how much of content has gone into your mind, but we have been fairly successful as far as a layman can think about us. So how has Loyola helped you in developing such skills? So I want 2 people to answer. One is, of course, a school leader, Suresh, and then Sudhi, and then Param. Roy has mentioned all his mentors in the school. I mean, all the teachers. So let us start with Suresh.
Well, I think I'll build on what you said, Sunil. I mean, communication, right? The billionaire Warren Buffett famously said, if there's one skill which can boost your career, that is public speaking and communication. Because you can be the most brilliant guy, but if you can't communicate your ideas, you have a problem, right? So I think that's one area where the school can really help. Kids should be having access to participate in youth festivals, elocutions, dramas, debates, and so on. Because only when you participate in that, you can improve your skills in terms of communicating and public speaking. And I also tell students and parents who I mentor, you can send your kids to programs like Toastmasters or clubs where they have opportunities to talk. Because it's not enough that you talk, you need to also get feedback on how to improve your communication skills. Just a small anecdote at home, right from probably a young age from my kids, we have debates at the dinner table. I'll throw a topic and get them to start talking, but and they're young initially, they didn't know what to say. But over time, they also start to understand what are the nuances of having a debate. Every Sunday, my kids would be given a topic and they'll come and do a presentation in front of us, because that's one way parents can get involved in teaching kids how to communicate. And they have to do a 1-minute talk on a topic. And it could be everything from mundane things like their favorite color to anything interesting for them. So if parents have to take a message from you and me today and from Warren Buffett, extremely important to learn how to communicate and extremely important now not to be able to do public speaking. I myself was a very shy person when I was in school. And when people forced me to be a school leader. I was a nervous wreck to be on stage. But with the help of Father Varkey, Father Zach, who was my favorite teacher when I was at school, we kind of overcome that. The second most important skill, I think, which is very important for kids and parents to understand is teaming, how to work in a team. Because every job today is a team, whether you're a surgical team or a research team or a management team, it's a team. And if you don't know how to work in a team, you are going to have a tough time being successful in life. So one of the best ways to learn the art of teaming is to play team games. And we did all that. At lunch, we were playing football on the football ground in school, or after school, we were participating in a lot of team games. And that's where we learn how to interact with people, get into fights, disagreements, strategize, lose, get disappointed, get out of disappointment, and win, and see the exhilaration of winning. And that kind of teaming skills, I'm worried that less and less kids are playing team games these days. And I think that's very detrimental. So if I have to take two things away from school, two things I hope school can help and parents can focus on are communication and teaming exercises.
Oh, great message. That comes befits the school leader. Sudhi, are you on the same lines? Do you have another viewpoint?
Well, I think what you have said about empathy and communication, everything has been. So let me say just one anecdote about something may not be that important, but still, I had I missed when I was in my school. I missed one of my geography exams because I was stuck with I had measles, and Susie George, Mrs. we used to call her Susie Miss. So she actually gave me an exam to write just for me because it was one of the class exams. So she kept me in an office and gave me the question, asked me to write that. It was obviously geography, some maps with it. So I had, as we all do, we had, all the maps in my pocket because I knew that I'll be writing alone. I could take it out and copy it. And so probably she knew that as well. And she told me, Sudhi, I'm going to leave you alone. Okay, you can, if you want, you may have something you can, but doing the right thing when nobody is watching, that is integrity. So remember, nobody's watching. That's something I can never forget. So it's just a small thing, but I think communication in English language, everything has been explained already, which is something which Loyola has definitely gifted all of us with, something which are really to be proud of, something which, our parents have given to us because by putting us in Loyola school, they've done that to us. Thank you.
Thank you, Sudhi. For about 30% of our audience is parents. So, Param, the question is to you. I'm sure that all the parents sitting there are really focusing on a career for their children, which is akin to something like totally only professional. There may not be much of communication skills or sports or any other parallel thing involved. So it's a very what do you call sensitive answer. What is the role of family in choosing a doctor career? Param, you can fire.
Well, don't get too involved, is my advice. There is a very Khalil Gibran's famous poem, your children are not your children. You might have brought them to this world. You can lead them, you can direct them, but don't force them into anything. It's a very poignant, powerful poem that I would encourage every parent. I read it every time I get into frustration with my children, but it's human nature to get frustrated. You would want your children to do what you would like them to do, but you'd have to read that poem every time. Khalil Gibran's Your Children Are Not Your Children. So essentially, you can guide them. My children are not in healthcare specifically. They're pursuing science. I do not know if they will enter into a medical field. But I do not think in this present day age, we should put too much pressure. What does a physician do? I mean, if you immigrate, it always gives you a livelihood. So no physician will ever starve. And if you immigrate to a country, you will always have immigrate and go to a foreign country. If you're a physician, you'll always have societal respect. You'll always have a livelihood. You'll always have societal respect if you maintain some integrity. But there are many other professions as well that could, in once upon a time, there were opportunities were limited for other professions, but it's not the case at the moment. So yes, so the candid answer to your question is don't get too involved. Let them do what they want to do.
Could you raise your hands? This is a poll among ourselves. Could you raise your hands? How many of your kids are doing medicine? Just to.
I'd like to just add something to that, Sunil. So
Yeah,
both
sure.
my wife and I are medics. But interestingly, I'm sorry, the phones are going off there. Apologies for that. But interestingly, we didn't actively encourage or discourage our daughter from taking medicine. And in fact, the head teacher at the school remarked that we were the first medical couple who seemed to almost didn't want her to join medicine. And the point is, we wanted her to choose medicine for the right reasons. I think she has. Having said that, I keep telling her, if you find something else that is your passion beyond medicine, that's fine, you know. But just wanted to caveat that because I know that there's a stereotype there.
I do understand. I do really understand that we are all parents now, and most of our kids we have left it on their own way. So I would definitely join what Parames mentioned as what I feel as a parent is nurture their aptitudes, and then the best will come out of them. Primarily because their aptitudes are inherent, God-given, and if you start pushing on those lines, they will excel in that beyond your dreams, rather than trying to make them a doctor, make them an engineer. So they are never made. You can't just make them something. You let them run. You just show the pathway. That's all. Or facilitate it. I would mean that should be the word. Just facilitate the aptitude of your children, rather than pushing them along those lines. This is possibly some psychological overview of becoming a doctor also. So that's the role of the family. See, one of the things which everybody, there's one relevant question here, as far as an aspiration of a doctor is concerned, the outlook of the public and the media about the profession. I wanted specifically to mention this being there is a question also voiced on this concern. Why is the violence against doctors increasing? We have a Q&A on this also. See, this is a peculiar scenario. This boils down to what we were saying earlier. Without a good communication skill, you can never be a good practitioner, because the person sitting opposite you comes from different culture, different socioeconomic background, different IQ, different way of analyzing things. You can't speak in medical jargon to a manual laborer sitting in front of you. So to make him understand what we are planning to do on the treatment aspect, or on the algorithm which a patient has to follow, we have to have excellent communication skills. We have to boil down possibly to our native language. We have to have a good knowledge of Malayalam. Though all of us do a lot of things in English, if you are to communicate there, practice in Kerala, if you are to communicate in the north, you should have a good knowledge of Hindi. In the layman's terminology, these are things which I still remember trying to learn Hindi there. This was one of the major failures which I had. And it is difficult because when I go to the north, it is difficult to communicate to even a lift operator, a person who stands there. So we find such difficulties there. So communication skills are essential. That is one of the reasons why the violence is increasing. Two is expectation. Expectation to the doctors when they come and pay an amount, when you're in the private sector, or when they automatically become like a consumer. So they become demanding. And in Kerala, you know, a lot because of the literacy, they know their rights also. So we should also have some knowledge about what we practice, the legal rights of your patient sitting in front of you. That is one good thing, possibly, as Sudhi and Param and Raju and everybody, Roy mentioned, working abroad will give you a good insight on how to communicate with the patient.
Sunil, could I just to chip in on this, I think it's absolutely right, but we should not also absolve the physicians as well. There are a lot of unscrupulous medical practice that also triggers some of this. There are always some bad apples in the basket. So one good thing about the Western system of medicine is the regulatory control of the colleges and the medical council, which unfortunately in India is a bit lax. So I think we should look at both sides. The patients have their rights, but the physicians have to come down from their high pedestals and behave like normal human beings. And I think we should not completely absolve the arrogance of some of the physicians as well.
Param, we are getting into the same thing. You're absolutely right. You're absolutely right. So we have to see, that is how the physician comes down. We have to see the person not sitting opposite to you 1:1. Then possibly, and you should understand something. When there are 100 good eggs, only the bad egg will be targeted by the media. If a person dies, Sudhi has done 1,000 liver transplants. If one donor dies, he is in the highlight. Not for the good things he has done before, not for the 9,999 patients he has saved. So that is something which we should always understand when we enter this field. We should have, that is where our school is also possibly going to help us. A lot of help is coming from our school because a lot of communication skills have been, I think I've acquired from there. Now, back to Roy, and possibly we are entering the final scenes. How is the profession going to change over the coming years? Because a lot of things are coming in: genetics, augmented intelligence, robotics, machine learning. Roy, could you just enlighten us on those things which are going to put medicine in a different format?
Sure, thanks, Sunil. I mean, I suppose I've already talked about a bit of that. But just to add to it, I think, medicine being what it is, the ultimate aim is to help patients improve care, improve disease outcomes. Technology and various other aspects will continue to play a very active role. You talked about genetics. Obviously, there's a lot of exciting work happening, including in oncology, around identifying mutations, targeted therapies, but not just oncology, in all other specialties as well. So I think going forward, we're going to see a lot more disruption, if that's the right word, in the field of medicine and healthcare, but in a nice sort of way, something that will help physicians and the practice of medicine improve patient care and patient outcomes. Because at the end of the day, it's all about our patients, right? I think we are trying to improve things. There is a lot more data. So, we have more personalized data. All of us use smartphones. We have different wearables, smartwatches, etc. And all that structured data is a potential useful tool to better inform how we can tailor medical treatments to improve care for our patients. So that is going to involve a lot more technology. And like I said, again, to reassure not just myself and everybody who is listening, I think we're going to see a closer marriage between technology and medical practice, not one taking over the other.
Thank you. Thanks a lot, Roy. Now, we are possibly entering the final scenes of our webinar, isn't it? I understand, Suresh, that we are possibly going overshooting our time. So let me just ask you a personal question. It's a personal question to all the panelists. If you have to do it all over again, all of you have reached a stage when you can go back and have a look, what will you do differently? Would it be the same thing, or would you like to have switched up your career and gone to a different plane altogether? Param, can we start with you?
Don't pick on me. I didn't join medicine out of choice. I joined the societal norms. I've been good at what I did. Success is how you define it. I'm not a rich person, but academically I've been enriched. We published quite a lot. We trained quite a lot. So this has given me a career, recognition, international. It's all good. If you were to do it again in medicine, what would I do? I would have done as a sabbatical, as taken subspecialty training in genomic medicine, which is what we are doing at the moment. So we could truly individualize care. I mean, Roy mentioned about targeted treatment, immunotherapeutics for cancer, but that's the way the world is going. We do it in many airway diseases to truly individualize. But if you're looking at a low income or middle income country where you're still struggling to deal with the masses, that is not essential. We have to still deal with the basic aspects of medicine, which is what we do in India. I don't think genomic medicine is appropriate, but if I were to retrain in medicine, I would have done a bit of genomic medicine. But essentially what I really wanted to do was not medicine, but a career in literature. I wanted to do English literature, PhD, and be a media journalist. But then I would starve.
That is something which is enlightened us also. I wish you were a journalist. You would have turned the world upside down, Param.
I would have been assassinated.
Okay, Sudhi, what about you? Would you do it differently?
So Sunil, I mean, every day if I think about it, there are so many things that I want to change, so many wrong decisions that I've made. Some things that I've said which have made people unhappy, some decisions I've made which have maybe killed the patient, some stitch that I put which have bled and had a problem, etc., etc. So definitely so many small things. But overall, if you look at, do I want to change my career? Do I want to change my family? No way. No, I think what I had has been very boring. But I'm happy as I am. If in my next life, I wouldn't choose a different career, different family, nothing else. Just a boring me. That's it. And I think I'll just quote Vivekananda in this one. He says, if you're not happy where you are, you're not going to be happy anywhere in the world, anywhere in the galaxy. So there you go.
Oh, Aju, your thoughts on this?
This is a question I always find very difficult to answer because I've always been a dentist and done nothing else. So if you ask me, would I be better in management? I really don't know. But would I have done something differently? Yes, because I've always gone with the flow. And I think much of my achievements have been because I've been at the right place at the right time. And that I think has made a huge difference to me. I think my advice to anybody who's coming into dentistry at this point of time would be choose the right college. Extremely important because you need to have hands-on training and a medical background. Definitely do your post-graduation because with the basic BDS you're going to find it very difficult to survive. Thirdly, communication skills. This is an area which I think even today in dental schools is not taught properly. If you go to a dentist, he will say you need to have a root canal done, followed by a metal ceramic crown with a 54 something done. The patient understands nothing. Finally, he'll ask you what the cost is. You say the cost, and he goes away. So communication skills extremely important. I think though we learned a little bit in school, in India at this point of time, communication skills are not being really taught in medical schools and dental schools. And finally, I think I would have done better is I would have done much more on-job training, upgradation, which initially in the initial phases of my career I did not do. Thank you.
Thank you, Aju. Suresh and Roy, both of you have, I'm sure that you're the guys who have split out. So you might have already done possibly what you wanted to do. Did you, Suresh?
Certainly, I think I'm pretty happy. I mean, obviously, I also have to point out that I've made a lot of mistakes, had a lot of failures along the way. And on reflection, probably if I had good mentors, I would have not done some of those or made some of those mistakes. But overall, I think the journey is as important as the outcome or the end destination. And the journey has been an outstanding journey.
Roy?
Yes, echoing what Suresh said. Look, I was someone, rather funnily, who wanted to become a doctor quite early on in my life. I was about 3.5 when I stuck some counting beads in both my nostrils, and my mother had to take me to LTM hospital in Bombay, and a very kindly ENT doctor. I was very impressed. Took them out very carefully, explained, he was very gentle. It must have obviously created an impression on mind. So some of my school friends would remember in the 6th standard, I gave a speech at Loyola at the school assembly as to why I wanted to be a doctor. Now, having said that, been there, done that, and obviously when opportunities presented themselves, I've embraced them. So I'd like to think that, I probably wouldn't change a lot, but as Suresh said, there have been things that you might want to do differently, but in the end, they're all stepping stones, and all these different dots joined together, and very happy and comfortable with where I am today.
Nice. It's so nice on my part. Also, I feel so happy to be a doctor. And as the final thing, it's an advice to the students getting into this career. I want Suresh to voice this. Primarily, can we just voice this and possibly end it here?
Sure. So let me talk about something we haven't touched on, I think, which is very important, which is, failures, right? I mean, these days, kids are so protected that the first sign of failure and they panic and they do drastic things. And if I look back at all our careers, I mean, we all had difficulties, we all had failures. And just to go back to school anecdotes, when I joined Loyola in 76 from abroad, I was in 9th standard and taking ICSE Hindi without knowing the alphabets. And when I was learning A, U, and E, my classmates were critically evaluating Premchand's Kahani. And I used to get single-digit marks, 1 mark out of 100, 2 marks out of 100. And it was depressing. It was extremely depressing, and it was tough. I couldn't follow what's going on in class. But I know I stuck it out. In ICSE Hindi in 10th standard, I got 22 out of 100, which actually I failed. And if I had known that even if failing Hindi, I would pass ICSE, I wouldn't have killed myself for 22 marks. I would probably focus on some other areas. The reason I want to point that out is to say failure is a part of life, right? And even now, with such poor marks in ICSE, I had difficulty getting into colleges. I was on waiting list to get into arts college. So all those challenges are things we all faced. Even in med school, I mean, I always wanted to be a surgeon because I worked with, was taught by Dr. Haridas and Dr. O.S. Menon, and phenomenal surgeons, great personalities. But unfortunately for my final MBBS exam in surgery, we had 2 external examiners who were extremely tough with the whole unit. And we all got very poor marks in surgery. And that was the end of my surgical career. And I was depressed too. I mean, I had a tough time. I mean, I didn't commit suicide, but I was depressed. And then we started this clinic with all the money we put in Chavadi Mukh. We blew it up in 6 months. We were broke, we were pauper. Again, failure, right? So, and again, I can go on and on. I mean, we all have failures. But remember, when you have given it your best effort and yet you fail, that means there is something better waiting for you somewhere else. So go look for it. And I have to thank all my failures for what I got to in the end. Because if I was successful in any of those, I could have been a surgeon somewhere else, or I could have a Chavadi Mukh hospital by now, or I could have done so many other things. Thank God for the failures, because that kind of processed my career to paths which I never dreamed of. So my message to students in Loyola is, go out and find what you're really passionate about. Try it, give it your best shot. If you give it a half-hearted effort, you fail, that's your problem. But if you're giving it your best shot and didn't work, look for something better.
Great message, great message. Yeah, the failure. We have this anecdote of many of us having had such depressing episodes during our career itself, whether it is a clinical physician, whether when we are treating a patient, when a patient dies, as Sudhi said, a lot of depression comes as what you call kuthum komeyum pole. In Malayalam, what you call kuthum komeyum pole. They just come and go. But then, if we can put all these failures into one basket, and if you can put all the successes into one basket, this success basket will be much, much more bigger, I'm sure. But then there is no amount to it. We can't quantitate it because it reflects on your happiness also. Thank you very much. I'm sure that all of you have done a great job. All the panelists have done a great job. We have some question and answer session here. Possibly we could answer that. There is one question which possibly is very relevant. Which are the best medical colleges to start with in India? My take on that would be you can Google it. Most of the institutes like All India Institute, the Postgraduate Institute, PGI, wherever the CMC Vellore, JIPMA, lot of good institutions are there listed according to their merit. You can Google it. This is available. This information is available to any medical student. I'm sure that you can get those answers there. Apart from that, there are some personal questions which are possibly addressed to explore LOBA as well as to all the panelists. You can definitely give answers to that at your leisure. So are there any winding opinions or winding messages which you would like to add on?
Can I just say?
Go ahead, Sudhi.
Yeah,
go ahead.
Yeah, please, Sudhi.
Okay, sorry, yeah. No, just a slightly off message, mainly for the students, more than the parents. So we are all telling parents to listen to the students, and likewise, I think it's very important for the students to know that the parents are doing it for you, not for anybody else. So their advice, please heed their advice. Particularly if your focus is as a distant dream. For the short-term terms, you have to have common sense. That's where your parents lie. So please, please, please do listen to your parents. Don't fight with them all the time. There is something behind that. Just look into that deeply as well.
Thank you, Sudhi. Now we can speak from both angles. Yeah, you're a grandfather also. Anything from the grandfather's side?
Yeah, I think they not too much of crying.
Okay. Anybody else?
Yeah, Sunil, I think I'll just close out on an anecdote, which I know we didn't do much anecdote from school. This was in 1977. Susie Miss did a surprise test, and we did very badly. Everybody failed, especially the top rankers. They all got very low marks in the surprise test. And she added that she was going to combine this surprise test marks with the final term marks. And that set a lot of people very worried, especially our top rankers. So they came to me as school leader and said, Suresh, you need to tell Susie Miss not to do that. And I, in my infinite stupidity, said, yes, that seems like an appropriate thing for me to discuss with Susie Miss. So I went and had a chat with her and said, Madam, you should not add the marks. And she went ballistic. How dare you tell me how to teach my class and what to do in class? And she gave me a real big dress down. I was so depressed after that. And I said, what is this? I was only the messenger and I'm getting beaten up for this. So I decided I'm done with school leadership. I wrote my resignation letter and marched to Father Vergis' office. Father Vergis was a principal, and gave it to him. And he looked at me and he said, what happened? And I told him, this is what happened. I was just the messenger, and she beat me up for telling her what the class wanted. And so I'm resigning. And he said, okay. Anyway, let me give you a piece of advice. And this is the advice I want to give the kids who are listening today. He told me, never make a decision when you're upset or angry, because you will regret it later. So sleep on it. We'll think about it tomorrow. So anyway, I went home. I was still angry. Couldn't sleep. And then finally, next day morning, I woke up and I was back in school. And I went sheepishly back to Father Principal. By the time I had kind of cooled down, and he looked at me, he smiled. He took the resignation letter from his desk drawer. He tore it up and put it in the dustbin. And we just smiled at each other and we walked away. But that's one lesson I learned from Father Vergis, which I practice even today. And it has helped me a lot throughout my career. Never make rash decisions, especially when you're upset or angry. So if I can close out on today, I know we're running late, we need to get to the polls. This is my message to kids. Don't make decisions when you're angry or upset. Sleep on it.
It goes about sending emails as well. Don't reply to an email if you're angry.
Absolutely. You can start the World War III. That's true. Yeah.
I should thank, as a moderator, all you great guys who have put in a lot of effort and spending time. It is nice that now all of us are parents. We know what the predicament the kids are also facing. Let God help them. Let all the teachers who have helped us also help them, because we have been molded by our teachers. I'm sure that Father C.P. Varkey, who introduced that new system of education where we were learning, especially that Shakespearean dramas. It was one of the best experiments I've ever seen. I mean, with the role play which we were in it, the film which he used to show regarding all these Shakespeare dramas, and then of course this tape recorder which he used to keep on playing, and then we had to recite a small passage in front of the assembly. That was one of the best experiments in teaching. I would say that we remember all that, we acknowledge all that to the school, and whatever which the good Lord has given us, all belong the school which we came from. Thank you very much. I think shall we wind up here?
Yeah. We need to
it's
put the
10:30.
We need to have those questions.
Time.
Sunil, we need the
you
poll
want all the questions? Most of the questions I've just gone through.
Sunil, the poll questions. We have 3 poll questions.
Poll questions, yeah, of course.
Binoy, can you put up the poll questions?
Yeah, so we are into the final stages. So we just wanted to know how the session went with you. So how do you rate the content of today's session? It's very good, good, neutral, and not good. So Binoy, we are 80%. Yeah, almost a distinction, almost. Combining both, I think we have reached more than 95. But there are 2% definitely it was not good, and 2% was neutral. So persons who think it was not good, please give us suggestions on how to make this better, because this process of mentoring is going to go for a few months from now. So please give us more suggestions on how to make it better. So the people who feel that it is neutral should give suggestions on how to make it good or very good. So thank you very much. Do we have another question, polling? Yeah, question 4. How do you rate the panelists? It has to be very good, please.
Hey, moderator can't be biased.
I don't have a voting chance.
This is not the US election.
Yeah, this is not the US election. Okay. Anyway, we have reached still, I think 90%, it is good, almost 99%, very good and good. Neutral is 1%. So all you guys have done well. And I should thank, definitely my thanks are due to Suresh from here. He has been the backbone of organizing this, along with Binoy, who has done all the technical stuff. And then, of course, Krishnoni. And I remember one more good colleague, Loyolite, I forgot his name, who was sitting there in the background, arranging all these things. So thanks off to the high-tech team, and thanks to our father principal. Thanks to our father principal, Joseph. We have not met you, but I hope you are hearing us. And then thanks a lot for giving us this opportunity from all around the world to interact with the kids as well as their parents. So shall we leave the seminar, Suresh, from now?
Yeah, I think we are done. So now we're done. Yeah.
Yeah. Okay. Thank you very much, and have a nice day from US and Canada. Okay. Bye.
Thank you. Thanks very much.
Bye.
Thank you. Bye-bye.